Hi, everyone. This is Wes Blakesley. This month, we welcome Dr. Todd Shatkin to our podcast forum for a discussion about a very timely topic, mini dental implants. Dr. Shatkin is a graduate of the University of Pacific School of Dentistry and is in private practice in Amherst, New York. He is the owner of Shatkin First, that's F-I-R-S-T, LLC, a mini dental implant specialty laboratory. Dr. Shatkin's article, Mini Dental Implants for Long-Term Fixed and Removable Prosthetics, was published in the journal Compendium of Continuing Education in Dentistry in February 2007. His 10-year study on mini dental implants will be published this spring. Todd, first I want to thank you so much for being here today. You know from our discussions how strongly I feel about general dentists placing their own implants. This is really a wonderful modality for that to happen, even for the dentist who doesn't really have a strong surgery background. Do you agree with that?
Absolutely. First, I just want to thank you, Wes, for having me on the program, and I'm excited to be interviewed and to talk to you about mini dental implants. I absolutely agree with you that every general dentist in the country should be offering these procedures to their patients. It's a very straightforward, simple procedure to master with a decent training program. You can learn this in a couple of days and start offering these procedures to your patients in your general dental practice. I along with Gordon Christensen, feel very strongly that it's something that should be mainstream dentistry.
I agree with that. Todd, before we begin, let's define our terms. What differentiates a mini dental implant from a conventional dental implant?
Well, that's a great question. The mini dental implants typically range in diameters anywhere from 1.8 up to 3 millimeters in diameter, and they come in various lengths. The conventional implants are anything over 3 millimeters in diameter and typically require a healing phase for osseointegration, whereas the mini dental implants are immediate loading implants. In other words, you place them through the tissue into the bone. It's a non-surgical procedure. They're threaded into bone, and they can be loaded immediately, either with dentures or with crown and bridge restorations.
All right. Todd, I'm just curious. What attracted your interest in mini implants? And I would ask you before we start our discussion, how many have you placed to date?
Well, I've placed over 10,000 mini implants since 1999. I was one of the first dentists in the United States, if not the one of the very, very first. I'd say in the first 10, probably dentists placing mini implants in the U.S. And what attracted me to it was the simplicity of the procedure. I got an advertisement in the mail from one of the implant companies selling these mini implants, and it said that you could stabilize a loose denture in under an hour. And when I started looking into it and thinking about it, it seemed to make a lot of sense. And the concept of being able to make that kind of a dramatic change for somebody in such a short time was certainly something that attracted my attention. And, you know, at the time I had been placing conventional implants for about 12 years, and I knew all of the time it took and multiple procedures it took for a patient to accomplish these type of results. And if I could offer something that could be accomplished in one or two short visits, very simply, affordably, and non-surgically, it would certainly make a dramatic change in my practice.
You know, it certainly sounds like well, I don't want to say no-brainer. I don't want to make it simplistic, but it sounds like something we all should think more about. In your estimation, what are the major benefits for our patients to have mini implants?
Well, there's tremendous benefits. Number one, it's quite a bit more cost affordable. It's quite a bit less costly, approximately half the cost of conventional implants. So that right off the bat is a big factor. Number two, the fact that it's really, I call it a non-surgical procedure. Some people may disagree with that term, but the reason I call it non-surgical is 98% of the time we do not have to make an incision in the gum, and we don't use any stitches. So if you're not using a scalpel and not suturing, I consider it non-surgical. But either way, you can call it a minimally invasive procedure if you want. But that's a big benefit to a patient, not having to have a real surgical procedure and recovery time from that. There's very little downtime. So the cost, the quick procedure, and then, of course, the immediate results, the ability to stabilize their loose denture or replace their missing teeth in 1 or 2 short visits instead of having to wait 6 to 9 months and going to multiple offices. And that brings up the other major benefit is the fact that your general dentist can perform the entire procedure without having to refer you to a specialist.
Yeah, we like that. Todd, I'm just curious, just as a sidebar, how does the pain level and discomfort level compare for mini implants versus conventional implant placement?
Well, I'm glad you brought that up because that's certainly another benefit. There's almost no pain involved. I would say there's a small amount of discomfort for the first 12 to 24 hours after the procedure. Within 24 hours, there's almost no discomfort at all. Most patients do perfectly fine with something like Motrin or Tylenol or an over-the-counter analgesic. Typically, we don't need to prescribe anything stronger.
That's got to be a practice builder.
Yeah, for sure.
Yeah, that's neat.
And another thing is nice is you don't have to give a nerve block for this procedure. Simple infiltration in the areas where you're going to place the implants is an advantage, so the patients don't have a completely numb mouth.
You know, they've got to like that. I know they hate bilateral blocks on the mandibular. Todd, what are the types of treatments that we can place on these mini dental implants?
Well, they started out back, like I said, in 1999 being used for primarily lower denture stabilization, and I started doing a lot of lower denture stabilizations the first year, and I started realizing that we were having such good success with the lower denture that I wanted to try it on an upper denture. So we started experimenting using the minis in the upper jaw, and usually we put 4 in the lower, and I usually put 6 in the upper. And if a patient has a bit of a gag reflex, we can cut a portion of the acrylic palate out of the upper denture and make them what we call a horseshoe upper denture with 6 mini implants. We had such great success with those over the beginning 2 or 3 years that I said, well, if they're working for dentures, why can't we use these for single teeth? So in about 2002, I started using the mini implants to replace single lateral, congenitally missing lateral incisors and bicuspids, and very quickly realized that these things were almost 100% successful. So we started using them on other teeth in the mouth and slowly evolved into using them for any tooth that's missing in the mouth and even for multiple teeth that are missing. And eventually we did complete roundhouses with these. So since about 2003, 2004, we've really restored almost any situation in any patient's mouth with mini implants. And to a point where I actually pretty much stopped doing conventional implants after doing those for a good portion of my career with my father. My dad was a DDSMD, maxillofacial and plastic surgeon, and we did all the major surgery with conventional implants, including sinus lifts, ridge splitting procedures, bone grafts from the iliac crest, and all those major procedures. We completely discontinued doing them, and in around 2003, switched over to almost entirely mini implant restorations.
That's amazing. Todd, quick question for the maxillary arch. You're just using a panoramic as your preliminary study of the bone?
Well, many of our dentists that work with us send us CT scans, but the vast majority send us panoramic x-rays. And interestingly, the panoramic x-ray, if it's a good quality x-ray, along with dental models, good models, can work very well together to let me plan a case efficiently and effectively. And I'd say 95% of our dentists still just send panoramic x-rays and models, and then I help treatment plan the case for them.
Okay. Todd, I want to jump into your first technique. How did it come about, and how easy is this technique to learn for the general practitioner?
Well, the first technique stands for Fabricated Implant Restoration and Surgical Technique. And the way it came about is when I discovered the fact that these things were having 98, 99% success, I thought of a method to place the mini implant and the finished crown restoration in one visit. So the way we came up with that is using a surgical guide stent and doing the surgery on the dental model, placing an analog in the model, and having the laboratory fabricate the restoration so that the implant lines up with the restoration and can all be done in one visit. And at that point, we needed a laboratory to perform those procedures, and that's when I started First Laboratory back in 2003, and now it's called Shatkin First Laboratory. The way it works basically is any dentist who's been trained on my procedures would take the necessary x-rays, models, impressions, and bite registration, send those to Buffalo, New York. I would personally review the case, plan the placement of the implants on the models, basically do the mock surgery for the doctor on the model, and then our lab technicians will fabricate a surgical guide stent and the finished crowns. And when the case comes back to the dentist, they can place that surgical guide in the patient's mouth, use our special pilot drilling instrument that positions the pilot drill right in the middle of the guide. You make your pilot hole, you screw your implant through the surgical stent, and then you cement your restoration on in one visit.
Wow. I'm interested. That sounds pretty compelling. Where do you find the candidates for this technique? Maybe you can just talk a little bit about, attracting patients, marketing, and what's the response of the patients? Are they pretty psyched about this? Is there an educational curve you've got to take them up?
Very little educational curve. It's a very simple concept for a patient to understand. We show them a dental model of exactly the implant and the restoration, whether it's a denture or a crown or bridge procedure. We have different models to educate the patient. And, we find that patients are very, very well receiving of the concept. Many of them have been to other dentists or other specialists being told that they have to have sinus lifts, bone grafts. It's going to take maybe upwards of a year to complete and an awful lot of expense. And when they find out that they can have this procedure done at a very less expensive way in a very short, simple procedure, it certainly piques their attention. As far as finding the patients, they're in everybody's practice. I mean, anybody who's got one or more missing teeth or suffers from loose, ill-fitting dentures is a candidate for mini implants. A lot of my patients come right from the hygiene chair. I go in for a hygiene check, and the patient's got one or two missing teeth, and they've never wanted to grind down their healthy teeth to do a fixed bridge or wear a partial, and this is just a great option for them.
What I really like about this technique is that it addresses, I think, the biggest barrier for implant dentistry, and I've been involved in implant dentistry since the mid-'80s, and I've been placing for about 12 years, but it's time. People will generally find the money for things that they want, but there's one thing that you can't buy, and that's time. And that really addresses that issue for the patient, and that's why this technique is so interesting and compelling.
Todd, we live in a community where people want everything done today, and they don't want to waste time, like you said. They go through drive-through for food and drive-through for coffee, and they don't want to sit around. And everybody's time is very valuable, including ours. And so it's a great procedure for the dentist as well because the chair time is very minimal.
Well, you're lucky because your patients want things done today. Mine want it done yesterday. So you're a step ahead of me. Todd, tell me about, what I would expect because, again, I'm starting to have a great interest in doing mini implants. What can we expect when we send a case up to your lab, up to Shatkin First? How does it go?
Well, I think it's very important that before we even talk about that we talk a little bit about the fact that the doctor has to be trained. They have to go through a training program, whether it's a training program that I teach or one of my colleagues teaches or another mini implant supplier might teach. Go through the proper training. Certainly, we recommend getting trained with a provider who's AGD PACE certified, but get the appropriate training so that you know what you're getting into and you know how to select the appropriate cases. Once you've gotten that training and you select the cases to send to Shatkin First Lab, like I said, you'll take good quality impressions, a bite registration, x-rays. You'll fill out a lab slip indicating what you want from the laboratory, the shade, the tooth numbers, and whatnot, or if it's a denture, you'll indicate that. What Shatkin first will provide is full-service laboratory work for mini dental implants from the beginning to the end. So what you'll get from us is, number one, I will personally review every case that comes in complimentary, free of charge. That's something that we've done from the beginning. And my dad and I started this business. When we started out, my father said, the only way I'm going to get involved in this business with you is if we can guarantee that every dentist who sends in their cases to us will have the same success rate that you're having with your cases, Todd. And that's what my dad, Sam, said. And I said, how are we going to do it? He said, because we're going to hold their hand through the entire process. And I said, Dad, how are we going to do that? And he said, we're going to review every case for them. We're not going to charge them. We're going to give them our advice for free and make sure that they do the case the same way you would if they were in your office. So that's what we've done since 2003. And so when you send your case to Buffalo, they first get poured up, they get mounted on the articulator, and then they get put on my desk along with the x-rays. And I go through every single case very carefully and thoroughly and plan it as if it was my own patient in the chair. And once I plan the case out and do the surgery on the model, then our technicians will fabricate the restorations and the surgical guides based on my plan. So when it comes back to your office, you should feel very confident that the case is planned appropriately and the restorations have been carefully fabricated.
Well, it sounds like a really nice service, certainly. Todd, I want to talk about your educational training courses because, quite frankly, if I'm going to fly somewhere and take a course, I want someone who's placed, 10 or 12,000 implants. That means a lot to me. Experience, as you know, means a lot. So tell us about your training courses up in Buffalo, and just give me a little rundown on that.
Well, I've been doing lectures on mini implants again since 2000, and all over the country and all over the world. In fact, I'm going to Australia next month, and I've trained over 9,000 dentists throughout the world on the mini implants. And, as you know, it can get tiring traveling all over the place. So about 6 months ago, I embarked on a decision to set up our own training center, educational training center right in our building. And we built a beautiful training center, hands-on training center with motors at every station, live surgical procedures shown on the big screen TV and screen, multiple screens right from our operating room with audio back and forth so we can talk to the dentist in the room and they can ask me questions during surgery. And we can train up to 55 dentists at a time right in our own training center. We had our grand opening last 2 weeks ago. We had a sold-out crowd of 55 dentists. It was very successful, and I have another one coming up May 4th and 5th. With our 2-day course, the first day we do a complete lecture. Many times I'll have a couple of guests also speak who've done a lot of mini implants. On the second day, we spend the first half of the morning in the lecture hall doing hands-on surgery on models. And the second half of the day, we do live surgical demonstrations on patients. And so it's really worked out well. So that's so that I don't have to travel as much, and also to provide a much better venue, because when I go to hotels, obviously we can't do much hands-on work. And this offers the dentists both the lecture training as well as the hands-on portion.
Yeah, that's really important. Todd, just in closing, I want to talk about the system you use. You use the Interlock mini dental implant system. What are some of the advantages to the doctors who select this system?
Well, let me tell you, Shatkin first does mini implant lab work and treatment planning for any mini implant system on the market. So the dentists do not have to use the system that we distribute or recommend. However, we are the United States distributor of the Interlock mini implant system, and I switched to the Interlock system about 5 years ago now from the previous system I was using. There are a lot of advantages to the Interlock system. Number one, they have a coating called the ASEAN coating. It's a patented surface coating, and it causes integration in the bone in as little as 3 to 4 weeks, as opposed to 3 to 4 months with conventional systems. The other advantages are the Interlock system are 30 to 40% stronger in tensile strength than other systems on the market, and that becomes very important when you're dealing with a small diameter mini implant because you want them to be very strong. Another advantage with Interlock is the delivery system. It's very, very easy to deliver the implant to the site with one movement without having to handle the implants at all in your hand or to transfer them. It's called the drive lock system, and the implants lock right onto the driver very easily. So all of those reasons, and I guess the other one is it's very, very versatile. They come in lengths from 10 to 18 millimeters in length. They're available in a 10, 11, 13, 15, and 18 in all three diameters, 2, 2.5, and 3 millimeters. So really, if you're looking for a mini implant system, the Interlock system provides everything that you could ever need in a system, including a lot of different abutments, straight and angled abutments for various situations.
Todd, just in closing, we're almost out of time, although I could probably go another half an hour on this. Do you have any concluding comments or any remarks that you'd like to make before we end our interview today?
Just that I'm very appreciative of the AGD, number one, of providing me with the opportunity as an AGD PACE provider to educate so many general dentists throughout the country over the last 11 years that I've been doing this. It's been a great service, and it's been something that I've really enjoyed doing. And having the support of the AGD has really helped me to get other colleagues involved in coming to my lectures. So that's the one thing. And just thank you for having me here today. I appreciate it.
No, it's our pleasure. This was a very, very informative interview, and hopefully we'll get a lot of the doctors who are listening in to start placing their own mini implants. To that end, how can our members reach you?
Yeah, our 800 number is 888-4-SHATKIN. That's 888-4-SHATKIN. The local number is 716-839-2959. So you can call that number as well. And, of course, ShatkinFirst.com has all of our information, including all of our products and services.
Well, that's great. Again, Todd, on behalf of the AGD, I want to thank you for being here, and I'm looking forward to meeting you soon.
I'm looking forward to it, too. I feel like I already know you. We've spoken a few times on the phone. Thank you very much, Wes.
Thanks, Todd. Have a great weekend.
You too.